Yeah, of course. Yeah, the most important thing for you to know as a clinician, yeah, what kind of treatment of stuttering the neuroscientists suggest. Yeah, but you know, when studying the literature, there is support for fluency techniques. Yeah, and these are those techniques that are proven to establish a normalized motoric pattern. Yeah, and that means to stabilize the normalcy of fluency within the young child that stutters. But on the contrary, for the manifest stutterer, more intense therapy is needed, focusing on relearning of speech, learning fluency per design. Yeah, and the efficiency are those treatments involving a reduction of speech rate in combination with gentle onsets. Yeah, and you recognize that the gentle onset, you were working with it, yeah, during the practice of voice disorders, yeah, vocal nodules and so on, yeah, and that's a very good technique. And this speech training therapy needs to be performed in combination with feedback control, such as evaluations by you and your client's own speech performance during the exercise. Yeah, and that is why you're asking your clients, were your onsets gentle, or was your speech rate long enough, and so on. Yeah. Yeah, and that's the approach to treatment. But now back to the conclusions from Andrews et al., and that was in 1982, concerning the efficiency of stuttering intervention, and that was the following. By learning to speak slowly with prolonged syllables, the connection between motoric pattern and afferent feedback will be facilitated for your clients who stutter. Yeah, and what he suggests is the Precision Fluency Shaping Program, the PFSP, and or prolonged speech as best remedial therapies for people who stutter. Yeah, because you see, at the beginning of training, they learn a fluent but abnormal way of speech. And during training, they learn a step-by-step use of a more normalized sensory motoric model of speech. And the amount of stutter is reduced because you train fluent speech in a controlled way. And that is why a correct motoric model will be strengthened. Okay. Oh, no. Don't get nervous and confused. Yeah, that's a thing. The stuttering desensitization through voluntary stuttering. Yeah, and that's the approach you have learned in stuttering modification therapy. You mean if it should be contradictory for establishing a normalcy of the motoric speech pattern? Okay, yeah, if they mean that it would be a contradiction for establishing a normalcy of the motoric speech pattern. Okay, thank you for saying that, because you know it's not me saying this. No. No, I'm only a messenger interested in general in evidence-based practice in stuttering. Okay, and that's therefore I'm reading the literature. You know, this kind of mental health strategies that propose efficiency of establishing a divinely fluent speech pattern is not in favor among physiologists. I'm not sure whether there has been a fMRI studies of the brain while producing voluntary stutter. And that would be studying its effects on sensory motoric pattern in combination with parts of the brain dealing with emotions. That could be, for instance, our limbic system. Yeah, that would be interesting and a great challenge. Yeah. Yeah, you wonder if there are any similar brain studies done for fluency shaping techniques? Yeah, yeah, I mentioned some of them in my report in 2001. Yeah, that was the evaluation report. Yeah. Of course, in recent years, there are several more neurophysiological studies made for measuring therapy outcome. They are using the brain mapping technique, and mostly they are from North America and Germany, because you see in Germany they had this similar project as I had, but they were 2 years earlier. Yeah, but you see they got recognitions by colleagues, so they had they have built up treatment centers, and they have good connections with the speech language pathology department. So there's another situation. Yeah, so they have produced many fMRI studies. Yeah, Gutenberg, someone, Neumann, and so on. Yeah. Yeah, and also there are other interesting things going on in North America as well. Yeah, and many of finger tapping studies and so on. Yeah. But the interesting thing is brain mapping technique. And I like these kind of empirical studies where they are just looking at the brain activity without any limiting theories in advance that has to be proven. Yeah, and here's one study that just focuses on the brain activity pre-post treatment and follow-ups. Yeah, and that was the Kroll and Neil study from 1998 mentioned in my report. Yes. Yeah. And you see, around the millennium shift, there was a project of PET scan and MRI studies of brain activity at the University of Toronto. And the aim was twofold. Firstly, comparisons between a group of stutterers and a group of non-stutterers performing linguistic tasks. Yeah, and what they were doing was oral reading and silent reading, and exercises to find a suitable verb to a certain noun. Yeah, yeah. And secondly, they did a comparison of the group of stutterers performing the same task after receiving treatment with precision fluency shaping program. And here they are working, like me, as a part of the comprehensive stuttering program. Yeah, and that was when you are combining the speech training with problem-solving strategies. And the participants were also examined after the maintenance phase, and that is 1 year post-treatment. Yeah. And the differences they found between the group of people who stuttered before treatment in comparison with the non-stutterers, that was that during silent reading there was registered a higher brain activity in a part of the limbic system. Yeah, and that part is the anterior cingulate cortex. Yeah, the ACC. And this was explained as a need for persons who stutter to control the different speech sounds together with the structure of syllables, within each word the same pattern as during oral reading. Yeah, and you know, this is a kind of reaction where they want to, they have an expectancy to stutter, and could be some old avoidance behavior, that they want to scan the different sound patterns to detect if it should be some sound that would be difficult to say, that could generate a stutter. Yeah, so you can compare it with expectancy to stutter and avoidance behavior. Yeah, for sure. And it's a type of reactions, yeah, and that's really a feeling of frustration. Yeah, and you want to see what the anterior cingulate cortex, what functions it has. Well, okay. Well, this structure is supposed to be a part of an inner articulatory loop, a sensory motoric feedback system that is activated in a higher extent when a person is proposed to do less automatized tasks. Yeah.